Hi friends. So the Kaiser Family Foundation recently did a study on how people feel about using chatbots to gather information. So instead of going into Google, which people used to do and just search, the question is, do people now go into things like, ChatGPT or Perplexity and enter in information and let the chatbot answer them? So they came up with some really interesting stats. We're going to have the link in the video here. I'm going to read off the stats because I think that they're really interesting. About half of the Americans that were studied, 56% of adults, can't tell if the information that they're reading from a chatbot is true or false. So trust clearly is something that we need to work on when it comes to the AI chatbots. One of the things that I thought was really interesting was that 17% of adults said that they've used a chatbot in the last month to ask a healthcare question. Now, that's low. That's only 1 in 6. So obviously we're looking at a situation where this has not been widely adopted. Most people are still going into Google to find health information. But I definitely think that we see an increase in the fact that people are searching out health information from chatbots. What's really interesting, though, is half of the people that they surveyed trusted the AI chatbots when they asked them questions about like cooking or technology or home maintenance. Only 29% of people trusted the chatbot with what it told them with health information. And for political information, only 19% of them trusted the information that they got. And this is actually a good thing for us, I think, as healthcare marketers and communicators. Listen, let me tell you something. People know that chatbots aren't necessarily trustworthy, and they are really concerned that the information that they're getting might not be true. So that's good for us because it allows us to really think in our content about what we can do to make sure that it's trustworthy. So the first thing is making sure that it's clear that we've had a practitioner look this over, that a doctor or a nurse navigator or somebody like who has, healthcare information really has made sure that this is factually appropriate and accurate for the American public. Being a published source, if you're working at a major healthcare organization, then that already gives you trust. But how do we feed our content into these chatbots to make sure that they are getting our content and that they're using our content? And that's something that people are starting to call GEO, which is generative experience optimization. I know it's like another acronym. Do we really need that in marketing? But we have a lot of information about that on our site. We will include those links. It's obviously all emerging. It's really fascinating stuff. We're following it closely for you. And if you have any questions, please drop them in the comments below. See you next time.